So this is a diagram of how we understand addiction impacts the brain. So when patients are using, or clients are using an opioid, what it does is it sort of floods our reward pathway, that blue area that you see in the brain. It floods that reward pathway with dopamine, okay? And when they don't have that dopamine, they feel bad, right? And in fact, what happens is that there's signals that activate parts of the brain that are focused on fear. And so when patients don't have the opioid, those fear areas of the brain begin to get activated. And the fear that they have is around withdrawal and feeling bad. So what do? And it's a natural response. The executive function part of the brain, the front of the brain, is going to say, I'm going to do whatever possible to make sure I'm getting that substance so I don't have to fear that withdrawal. I don't have to fear feeling as terrible as I do. So as addiction progresses, there's less of that seeking of the reward of intoxication and more of the brain simply trying to avoid feeling bad. This is because the mood symptoms that come with use or coming off of use, or the withdrawal, is actually going to worsen with time. So more and more time is spent, more and more mental energy is spent trying to get the drugs to get out of feeling bad. Medications for opioid use disorder work by getting clients out of this vicious cycle. Buprenorphine and methadone specifically are going to relieve withdrawal. So the clients are not going to feel withdrawal once they're initiated on buprenorphine or methadone and on a stable dose of that. They're not necessarily going to take away all cravings, because there are still other things, people, places, things, environments, that can trigger a craving for these individuals, but they are going to decrease those urges and cravings significantly. What does that do? That allows the brain to shift its focus and begin thinking about those other things that are important: work, family, social, all those things that are going to make the client feel whole again.